So this is our Conditions That Complicate Care project. We have Megan, Maddie, Sue, Liz, and myself. So to start, have you ever thought or heard of a clinic that is well-funded, consistent, predictable, and has a calm environment? Probably not. So when this doesn't happen, it leads to burnout, secondary traumatic stress, and compassion fatigue towards our patients. So starting with burnout leads to emotional exhaustion, lack of professional accomplishment, and depersonalization from your day-to-day life. So a quick little study, over 200 PTs completed this outcome measure, and 33% of them said documentation was their biggest stressor, and 67% of them said work was their greatest source of stress.
This is the effort-reward imbalance model. This includes a theory that between effort and reward, there can be an imbalance that leads to burnout cases. So we can see that if effort, including workload, time pressure, responsibilities, and overtime are all overcompensated and there isn't enough reward to balance that out, such as salary increase, esteem, good relationships with your colleagues and management, promotions or job security, then we have an imbalance where there's no alternative available, and the situation is just being accepted for what it is. There's a specific motivational pattern that's present, an overcommitment issue that is found in other studies as well. And that's where we find quite a bit of burnout associated with those. So this came all the way back from the 90s, 1996. We saw this happening. Threatening job conditions equal a mismatch between high workload and low rewards. Overcommitment to the job may negatively impact the balance between effort and reward as well. Sort of an alternative is that the therapeutic relationship quality can lead to burnout. So if therapeutic relationships with clients, depending on quality, can significantly contribute to either causing or reducing burnout symptoms as well.
So now let's talk about secondary traumatic stress syndrome, or STS. So it's defined as an acute stress reaction depriving or deriving from the work with patients who have been traumatized. So it's like a secondary response to the traumatic experience that the patient had. How to manage this: you need to increase your self-efficacy, increase your resilience, and increase your social support. So easy. Let's talk about compassion fatigue now. So it's the inability to empathize with another person when they're going through a traumatic experience. It can be physical, emotional, or spiritual in how it presents. And compassion satisfaction is actually the opposite. We need more compassion satisfaction to mitigate the compassion fatigue that we have with patients.
So the good news is that there are a lot of interventions that can help out with burnout. So I have a whole list of them here. So first is motivational programs. So this is some sort of like patient appreciation event, something like that, where you're being recognized for your work, especially by those that you serve. And so increasing autonomy is found to have a big effect on burnout. So when PTs have more autonomy, then they have less burnout. Opportunity for career growth. Obviously, none of us want to stay at the bottom of the totem pole forever, so that one's pretty self-explanatory. Mindfulness, we've talked about this in class before, but increasing mindfulness both at work and in your personal life outside of work helps also mitigate symptoms of burnout. Social support, kind of what Summer talked about, is also a big factor. And then in increasing self-efficacy, which Summer also talked about, opportunities for CEUs is also a big thing that helps mitigate burnout by making PTs feel more accomplished and like they can do more. And then finally, increasing respect for the profession, particularly in multidisciplinary teams. So it was found that PTs who were working in teams where they were not as respected as maybe some other team members, such as physicians, they had significantly increased burnout, which obviously is not a good thing. So increasing respect for the profession of PT is also something that helps.
All right, so beat the burnout, become the patient.
PT for the PT, who would have thought?
So what are some things that we as healthcare professionals can do to minimize the effects of burnout, or dare we say treat it? So burnout, as we have heard, that it is a diagnosis, but it does not have to be a chronic one. So there was actually meta-analysis conducted in 2018 that looked at the efficacy of exercise therapy on occupational caused burnout. So it was found that, the therapy programs were highly varied and often unclear, but treatments for burnout included encouraging a healthy diet, taking vitamins, reducing alcohol consumption, relaxation and mindfulness therapies, gymnastics, sports, massages, etc. So often individuals were actually treated with regimens designed to treat depressions, so i.e. prescribed antidepressants. But the meta-analysis found that a common underlying theme of the therapies included three major components. So you had general strengthening, relaxation, and occupational support, which consisted of decreasing job demands and increasing job control or level of participation in decision making. So what is the relationship between physical activity and burnout? So above all, there is a positive relationship between physical activity and the emotional well-being. So it actually fosters the development of perceptions like mastery and self-efficacy, and therefore diminishes the sensitivity to negative stimuli while you're at work. It also reduces the person's physiological sensitivity to chronic stress, i.e. burnout. So employees can actually deal with stress at work without being physiologically overwhelmed by it, and so which leads to a faster physical recovery after a very stressful situation, and therefore reducing the risk of burnout. And additionally, aerobic physical activity reduces anxiety, which, as we all know, is present in the occupational context. So in conclusion, although the meta-analysis did not provide sufficient evidence to fully say that exercise therapy is effective in persons with occupational burnout, but that there is a positive correlation, positive influence on those experiencing burnout while incorporating physical activity to combat it.
Thank you for listening to our presentation about PT burnout and ways that we can mitigate factors that contribute to this in our own experiences. Please check out our case study to explore more of these ideas and themes, and so we can be successful physical therapists who enjoy our career. Thank y'all.